Hello guys, welcome back to the channel. It's Unit 7 Part F.
Hydatidform mole, or also known as vascular mole. This is nothing but when an embryo is formed, the embryo start to degenerate, in the sense the baby is not developing properly inside the cells which is present inside the embryo will start to degenerate, in the sense they start to die and start to expand, and they start to leak out. This is also considered as a cancerous mole. Here, abortion or the removal of this part is very important. This is done immediately after confirming there is a presence of vascular mole. Sign and symptoms seen in this are abnormal bleeding. This bleeding is not continuously seen in one flow. Ups and downs are seen. For example, if today the female is feeling heavy bleeding, suddenly at the afternoon or the night section the bleeding will be completely nil, and suddenly after 1 or 2 days or next day itself the bleeding is again high. This is how the up and down bleeding will be continuing, and abdomen pain is constant and it will be increasing gradually day by day when this condition is getting more worse. Vomiting sensation is seen because of chorionic gonadotropy. Breathlessness, tiredness, everything is seen, and this condition can lead to severe conditions like preeclampsia, most likely to lead an hypertension conditions, sugar, BP will occur. Convulsion is the last condition that occurs in this case. And the diagnosis of this condition is, first, because of irregular bleeding and heavy bleeding, we will check the blood count and the type of blood group. And at this condition the hormonal level, everything will be imbalanced, there will be ups and downs. To make sure there is no any other underrelated conditions like renal problems or thyroid problems, we do test for that, and definitely ultrasound will be performed to detect how big the mole is, how to be removed and all. And while this, one thing to remember, the first management that is done is soon after detecting, the first thing we do is that removal, that is emptying the uterus. This emptying the uterus requires some criteria, that is the age of the patient, at what condition this mole is, and how big the mole is patient is ready for this operation or this act. We will see every criteria and then we will perform the act. And before performing the act, there are actually two types. First of all, the mole, you know if it is deep inside the uterus, then we need to remove it. And there are few moles which are almost about to fall. There is no need of performing the act, like they itself will fall off. Okay, either they are about to expel or we need to insert and expel it. We should see that, and then after the case will be proceeded. The removal of this mole is done in this two way, hysterectomy or hysterectomy. This two procedure, if you see, the first one is involving the cutting of uterus, while second is involved cutting of the partial part. By based on the place and based on the size, the procedure will be performed. After removing, we will provide chemotherapy, methotrexate 2.5 mg. This is given to make sure the HCG level hormone is normal. During the time of pregnancy, during the embryo is developing, the HCG hormone will be more. But in this process, we are removing the embryo, so this level should become normal. All of sudden it cannot become normal, so we will provide the medicine. Apart from this, other conditions, based on that conditions we will provide the medicines. Like if the patient is very dehydrated, we do give IV fluids. If the patient has lost enough amount of blood, then we will give her blood, and blood transfusion will be performed. Iron tablets will be given, calcium tablets will be given, vitamin tablets will be given. Like that, based on this condition it will be given, but this is the main management performed here. Hydramnios, or also known as polyhydramnios. This is a condition in which the amniotic fluid inside the uterus or inside the womb is produced more than enough, that is more than 2000 ml. This is polyhydramnios. This can be detected just by observing the uterus size. See, in particular month the uterus should be only this much. In 2 months it should be 30 centimeter. In 3 months it should be 35 centimeter. Like that there will be some kind of count. Like in 1 month it should increase only 2 inches, like that. But if you see in this case, because of this amniotic fluid, the uterus will be expanded so big. The size of the uterus will be very large. That's the main symptom of this. And the problem with this condition is you will be not able to listen to the fetus heart rate. Because of the distance, you will be not able to listen to its heart rate. If you're not listening, then what's the problem? You will not come to know whether the baby is healthy or not, whether the baby is growing proper or not. There will be lots of problems upcoming with it. If you find this condition within 24 weeks of the pregnancy, that will be considered as acute. If you find at the end of the pregnancy, that is chronic. What causes polyhydramnios? In mother, if they have RH isoimmunization, that is, you know already, mother and baby has different RH. If mother has diabetes, then this condition occurs. If mother has any cardiac or renal disease, then this condition occurs. Next, in fetus. Fetal cause is very simple. Multiple pregnancy, more than one baby, that is twin. Generally, amniotic fluid will be increased. If fetus has any abnormality in it, then also the amniotic fluid will be increased. Few examples for fetal abnormalities are spina bifida, utropelvic function obstruction, malfunctioning of lungs, Down syndrome, rubella sepsis. These are few examples of fetal abnormality. The sign and symptoms that is seen in this condition is dyspnea. There will be even a breathing disorder in mother. Mother feels very heavy. Edemas can be seen. Enlargement of abdomen. Mainly, if you see there is a swelling, you will know how the skin is there. So, since the stomach is very much enlarged, the skin here will be very shiny. There will be large stretch marks. The height of the uterus is large, so the girth of the stomach is also, the girth of the abdomen will also be very more, and the fetal part will not be well defined. These are the signs and symptoms generally seen in this. What are the complications? What are the problems related to this polyhydramnios? If the mother has polyhydramnios, then it can lead to hypertension, premature labor, premature rupture of membrane, respiratory discomfort. These are seen in the mother. Well, the fetus which is present inside the womb, that is intrapartum complications, are placenta abruptia, cord prolapse, placenta insufficiency. Increased incidence of C-section is seen in this condition. Apart from this, after birth, if you see, because of this polyhydramnios, there is a chance that fetus may have congenital abnormalities. In the sense, by birth itself, there might be some kind of abnormality present in the baby. Diagnosis of this condition involves maternal antibody screening, diabetic screening, torch serology. If everything comes negative and still we have polyhydramnios, it's quite common. Sometimes the cause is not known, and we will start to give the treatment for the patient. And the treatment is nothing but amniotic fluid decompression. We remove the excessive of amniotic fluid present in the uterus. And at the time of delivery, we will make sure the delivery is the normal delivery. If there is any complications that is stopping the normal delivery, then we will undergo C-section. This is all about polyhydramnios. There is a small thing to be noted. It's a small topic, that is oligohydramnios. I am going to teach you with comparing it with polyhydramnios. Just now we have been completed polyhydramnios. Here the amniotic fluid level will be more than 2000 ml. But if you see, polyhydramnios is the condition where the amniotic fluid is less, very less than 200 to 500 ml. When the amniotic fluid in the womb is more, that is polyhydramnios, whereas if the amniotic fluid in the womb is very less, that is oligohydramnios. In this condition, in polyhydramnios, the uterus size will be very large. But in the oligohydramnios, the uterus size will be very much small. Then in this condition, in polyhydramnios, if you see, we can't hear fetal heart rate. It's because it is faded here. Because of the distance, the fetal heart rate cannot be heard properly. And here in oligohydramnios also you can't hear fetal heart rate. It's because the fetal is not well active in this condition. Because of no amniotic fluid, the fetal can't move. The fetal is not active. Because of not active, we can't hear fetal heart rate properly. And remaining everything is almost same. For example, the premature rupture of the membrane, fetal congenital abnormalities, fetal growth problem, everything will be same. They both differ in one thing, that is treatment. In the treatment, if you see in polyhydramnios, we will try to make sure the delivery is normal or C-section. This is what happens in polyhydramnios. But in oligohydramnios, we will try to undergo termination. We will try to abort, because here without amniotic fluid, without the proper level of amniotic fluid, we can't undergo the pregnancy in a healthy way. So normally in oligohydramnios, we will see the possibilities of termination, whereas in polyhydramnios, we will see to make sure the delivery is happening in the normal way.
Questions will be provided at the end of the chapter. Until then, stay tuned. Bye.